If you have ever struggled with pain from hip impingement, you know that it can be really difficult to find something that actually gives you some quick, in-the-moment relief. Many people will try to stretch their way out of the pain with hip impingement, and they're left either feeling like it doesn't do anything, or sometimes it just makes it feel worse. And the reality is we really can't stretch our way out of hip impingement. In fact, stretching can actually aggravate your symptoms sometimes. So it's important to learn what are some more effective ways of getting yourself some quick release. The thing that's going to change your hip impingement pain long term is actually not going to be stretching. It's going to be the strengthening piece of things. So when we are looking to the future of how am I going to make this problem go away and stay away, it's actually going to be the strengthening piece that's going to be the most important for you. And the reason for that being, when our muscles or our body is feeling unstable or has pain, what our body will sometimes do is that it's going to tense those muscles up more to create a sense of stability, right? And oftentimes with hip impingement, what it comes down to is having weakness or instability in these deep hip stabilizers, these deep hip rotators. And so when there's that instability there, our body's going to tense up. It's going to hold onto that tension to try to give ourselves sort of a false sense of security. And then you are left feeling really tight all the time. But the root cause of why you're feeling tight isn't that the muscle's just tight. It's that it's actually weak and unstable. And so we really have to make sure we're going after the root cause of the pain if we want to get a change long term. So that's all fine and good, right? Okay, we can strengthen, but what do we do in the moment when you are feeling pain and you need to get some quick relief? Again, stretching may not be the answer here, but the thing that I usually direct my clients to instead is doing some soft tissue mobilization. That's usually a way to get some relief in the moment, and it doesn't tend to re-aggravate your symptoms like overstretching or just stretching may do. So the reason what we're going to go over today is kind of where you're going to do the soft tissue work, and it might surprise you a little bit because I'm sure many of you, when you feel your impingement pain, you're feeling it sort of on the front side of the joint. And that is true, that is where the impingement happens. However, we are actually going to do the soft tissue on the back side. So the reason for this is, if we look at the skeleton, now if you've watched any of my videos before, we talk lots about how with hip impingement, the goal is to keep the head of the femur centered in the socket when you move, which means we need to get a little bit of posterior glide. If you're not sure what I'm talking about, I'll link one of those videos down below just so that you can kind of familiarize yourself with that concept. But really what has to happen is the head of the femur, when we flex our hip up, has to glide back a little bit into the socket here. And so all of your deep hip rotators and the muscle, if there's muscle tension in them, they're held on the back side of the joint here. So again, if there's muscle tension held in those rotators, when I go to flex my hip or move my hip, it almost blocks that posterior glide. So it kind of stops that movement from being able to happen. So when we are tight on the back of our hip, it creates more pressure and compression on the front side of the joint, which is why when we're going to do the soft tissue, I'm going to direct you to do it on the back side of the joint. Now, even if you don't feel pain on the back side at rest, you will maybe notice as you start to do some of the soft tissue work that it does become a bit uncomfortable in places that you didn't even realize were uncomfortable. So the way that I generally like to instruct in soft tissue is using a tennis ball or a lacrosse ball. And you're going to use the wall. We are not going to sit on it on the floor. I find, especially when people are really aggravated with their hip impingement, sitting on it is too much pressure and it tends to make things a little bit worse. And our goal here is to try to calm things down. Remember, we're looking for a quick fix, immediate pain relief, right? So I usually do it right up against the wall. And again, you can kind of just find the spot you're going to go to the back of the hip and you just find the spots that feel tense. Now, the most common places that people with hip impingement are going to feel some tension are going to be sort of in this upper quadrant here, sort of from the tailbone over to this lateral hip bone out here. It's kind of working, this is your glute med muscle. You may also, coming down a little bit further into the center of the joint, closer to where your piriformis is, sometimes that area is also a little bit irritated. You can also check down even a little bit further, sort of right underneath the glute here, kind of where the glute and the hamstring meet, the glute and the top of the thigh meet. Sometimes that area is a little bit tender, but for the most part, I usually tell people to kind of start in the top quadrant and work your way down. And again, now you can just kind of roll around here, whatever feels good. If you find a spot that feels uncomfortable, rather than digging in as deep as you possibly can, because if we do that, what's gonna happen is our muscles don't like it. They're gonna guard up and tense up against you, which is the opposite of what we want to happen. So we wanna ease into that muscle to teach our body that it's safe, to get it to relax. So when you find a spot that feels uncomfortable, you're gonna kind of hold your pressure there, tolerable amount of pressure, right? I'm not digging in as deep as I can. What I'm gonna do is I'm gonna wait till I feel that pain start to dissipate. Usually it's gonna take 8 to 10 seconds or so. And then once that happens, you can push in a little bit deeper. Same thing, the pain's gonna rise, wait till that pain starts to dissipate again, maybe another 8 to 10 seconds, and then one more time, push in. So you're kind of easing the tennis ball in on a trigger point deeper and deeper versus as hard as you possibly can the first go round, which again, our body's gonna kind of not like that so much and tense up a little bit more. So we kind of ease our way in. Now, if the wall isn't enough pressure for you, you absolutely can do it seated on the ground. But again, for most people, I don't start them there because that tends to be much more pressure and a little bit more uncomfortable. The other thing that I want to mention to you here as well that's really important, and this goes along with anytime we're doing anything for mobility. So before you do your soft tissue, if you are going to stretch, before you stretch, when we have hip impingement, one of the issues is often that we are holding on to this increased tension in our hips, our glutes, our pelvic floor. And so something that can really help with that even before you start the soft tissue, or if you are going to do some mobility work, is going to be deep breathing and trying to release the pelvic floor muscles, release the glute muscles, kind of start to downtrain that nervous system. Because when we're already in a pain flare-up, our nervous system is sort of on alert. It's heightened, right? And so if we try to go in with a tennis ball and start massaging things, sometimes it sends out more of those alarm bells like, hey, don't do that, it doesn't feel good. And so our body tenses more. But if we can do some deep breathing work to downtrain and re-regulate that nervous system first, your soft tissue work would be far more effective. And then the same goes if you are doing some mobility work. So if you guys don't know how to do diaphragmatic breathing and deep breathing, I will also link that video below. I already have a video describing exactly how to do it, so I'll link that one for you as well. And then the last thing that I want to mention, while I did say that stretching and mobility work generally isn't the place I'm going to start with somebody for pain relief, there is a time and a place for it. It's just about figuring out, is that something that your body needs, or is it going to make it worse? Now, a good cue for you would be if you've already tried stretching and you're like, I've stretched all I possibly can and there is zero change, then that probably isn't going to be the technique for you. But if you do get some relief through mobility work, then again, I'm going to link a couple of my favorite ways to stretch the glutes, again, posterior side of the hip joint. I'm going to link some of my favorite ways for you guys to stretch that so that it doesn't re-aggravate your symptoms. So again, just a really quick recap. Number one, you're probably going to do some deep breathing, downtrain that nervous system. Then we're going to go in with a tennis ball or a lacrosse ball to the back side of the hip joint to try to release the tension here so that the pain and the compression on the front side of the hip can be relieved. So if you guys have any questions about that, leave me a comment below. I'm happy to answer questions.